Good afternoon and welcome to today's Show Me Renewal Town Hall. My name is Emily Spain. I'll be serving as this afternoon's moderator. I am a proud MU alum and also evening anchor at KOMU 8. So this town hall will focus on the plans for this upcoming fall. We've pulled together different university leaders to answer your questions about their plans so far. And here's how the town hall will work. They've already received hundreds of questions, about 300 for both today's town hall with faculty and staff and tomorrow's town hall with students and parents. And we will be accepting live questions throughout the event. To submit your questions, please see the link to submit questions. It's on the event page where you're viewing this webinar right now. I'll read those questions and direct them to the appropriate university leader to respond. Now, after the town hall, they will be posting this online for you to view the full session later if you miss any of that. That'll be at chancellor.missouri.edu under the town hall tab. Before we begin, we're going to send it over now to President and Interim Chancellor Moon Choi for a few words. President Choi. President Choi, you are muted, so I'm going to have you unmute and start over.
Thank you, Emily, and good afternoon. I hope that everyone is in good health and also in good spirit. During the past 3 months, a dedicated group of faculty, staff, and administrators have been developing a plan that we call Show Me Renewal. And I'd like to ask if the slides can be shown so I can discuss the highlights from this very important plan for the university. And this plan, as you can see from this particular slide, really focuses on your health and your well-being as the top priority. And the path to renewal, we know, has to be developed with a cautious, but also a strategic approach. And during this process of developing the plan, as well as implementing the plan, even with the potential pivots, depending on conditions, we're going to follow all of the guidelines from the Boone County Health and Human Services Organization, the CDC, and obviously our top medical staff at Student Health Center, as well as MU Healthcare. Back to the slide, please. And as part of this plan development, we have had 7 task forces looking at areas ranging from student affairs, as well as the academic program, and athletics to communication. And each of these areas, we had our top experts provide the input. The ideas were vetted through many stakeholders, including faculty, staff, and students. So as part of this, as you can see in the testing, tracing, and quarantining, it's an activity that's led by Dr. Stephen Witt, Dr. Scott Henderson, and Dr. John Middleton with other leaders from the university to develop the testing capacity at the university, to be able to hire contact tracers to work with Boone County Health and Human Services, and to provide the quarantining spaces that we need on campus for our students. Next slide, please. And the key expectations are really no different than what we've been hearing from Dr. Fauci and also the CDC. And that is to maintain that social distance of 6 feet or more, wear the face coverings, wash your hands, monitor your health, and at the same time, practice these precautions whether you're on campus or off campus. And many of our faculty and staff want to get back and to engage in the camaraderie, the in-classroom teaching, as well as research. But that ability will really depend on all of you following these guidelines, not only for your protection, but the protection of those around you. Next slide. And we are really in a unique place at this university to be able to work with a hospital that is owned by the university with outstanding physicians and nurses. And during the height of the COVID crisis in Boone County, we have prepared 400 beds to treat COVID patients. So we have that capability to go into critical mode to be able to handle potential surges that occur in this at this university and in the community. With the efforts of Drs. Witt, Henderson, Mark Dietrich, our emergency management official, and John Middleton, we believe that we'll have the capability of doing 3,000 tests per day, the PCR test, by September. There'll also be two two-lane drive-through testing facilities with results typically within 24 hours. Next slide. In terms of face covering, we decided that we will follow the Columbia City Ordinance regarding face covering. And so in buildings, whether it's in classrooms or offices, in the hallways, and within the general meeting areas of buildings, face coverings will be required. You don't need a face mask if you are alone in a private workspace, whether it's an office or it's a research lab, or if you're outdoors and you can maintain at least 6 feet of distance from another individual. Instructors, like you see in a smaller classroom, will be wearing a face shield. That way, students who need to read lips to understand the faculty member can do so. So the thought that went into this process by Dr. Matt Martins and many others really should be commended. Next slide. And if you look at a lecture hall, there will be very, very few large lecture classes given the need to socially distance and reduce the number of participants or students in the classroom. But when we do have these opportunities for lectures, then the students will be spaced 6 feet apart. They'll also be wearing face coverings, and the instructor, who will always be at least 6 feet away from the students, will wear the face mask. Next slide. And the common areas, whether they occur in buildings or residence halls or the library, will have proper spacing. So our facility staff have been working overtime to reconfigure all of our spaces in both classrooms, laboratories, as well as the common areas, as you can see from this slide. Next slide, please. And I believe this is the last slide, and it shows the student center with the proper spacing for students to study and interact, but still maintaining the guidelines that we seek for maintaining the health and safety of all of our students, faculty, staff, and visitors. Next slide. So that is the last slide, and I look forward to joining you for some of the questions. But now it's time for me to turn it over to Ms. Hannah Clampett, and she is the chair of the Mizzou Staff Council.
Thank you, President and Interim Chancellor Choi. I want to start out by acknowledging my counterpart, David Miller, who is the Staff Advisory Council Chair for System. So I want to start out by thanking my fellow staff members for your flexibility and commitment during these just unprecedented times. We managed to quickly pivot to working from home. We have experienced furloughs and pay reductions. We have had uncertainty about our jobs, and we have had to say goodbye to our peers who are no longer working at MU. And these have been very challenging times. I also want to thank our operations team for their work in cleaning and preparing campus for repopulation. As we return to campus, I think it's important for us all to work together to follow the safety and health precautions to keep our students, our faculty, and our fellow staff safe. Our personal opinions on precautions are going to vary, but I think that we can all agree that keeping our students safe is the most important thing, and we all need to do our part to keep them safely on campus. A lot of staff are experiencing concern and hesitation about returning. And I think if we can follow precautions, that's a way for us to show that we care about them and their very real fears. I think our leadership has done their best to plan for our safe return, but as we know, plans change in these times. So I think if staff can continue to be nimble and flexible, and we can adjust as needed. As always, Staff Council is here for your feedback and concerns. If you're experiencing a practice or a policy that you think can be improved, or you have other suggestions, please reach out to us and we can share those concerns with leadership. So again, I just want to thank you, my fellow staff, for all of your hard work during just these incredibly challenging times. I am proud to be your colleague. Thank you.
Now going to hear from Faculty Council Chair-elect John Middleton. John.
Thank you, Emily. On behalf of the Faculty Council, I'd like to welcome you to this town hall to discuss the Show Me Renewal plan for fall semester. As Emily said, I'm John Middleton. I'm a professor in the College of Veterinary Medicine. I'd like to start by thanking the members of Faculty Council for their input on matters related to the issues that we're dealing with. And I'd specifically also like to thank our outgoing members and especially Clark Peters for his leadership of Faculty Council over the last 2 years, and particularly during these last few months when we've dealt with many different issues on our campus, including COVID. We learn more every day about SARS-CoV-2, the virus that causes the COVID disease. And while much has been learned over the last 6 months, this is an ever-changing situation where we learn more every day. As much, it's a fluid situation that requires an evolutionary planning process, and as has already been iterated by President and Interim Chancellor Choi and also Hannah, we're going to have to remain flexible as we move forward here. There are no perfect solutions to the issues that we face, and those we will continue to face during the months ahead. A great deal has been rapidly published in the press, on social media, and in the scientific literature, and as members of the public that receive that information, it can be daunting to filter out and interpret that information. Therefore, as we put this plan forward, we assembled a group of people to filter that information as best as possible and come up with the best plan based on the information we have at the current time. And that plan is aimed at reducing disease transmission within our MU community and the community at large, while enabling us to do those on-campus activities that President Choi referred to. So while representatives from various campus constituencies have been involved in this planning process, it's now time for us to hear from you and continue to hear from you as we move into fall semester so that we can get feedback from you and adjust the plan accordingly as we move forward.
Okay, John, thank you so much. Let's now introduce all of our panelists joining us here today. Provost Ramchan, Provost and Executive Vice Chancellor for Academic Affairs. Beth Chancellor, the Vice President for Information Technology and Chief Information Officer. Marcia Fisher, Associate Vice President for University of Missouri System Human Resources. Maurice Gibson, Vice Chancellor for Inclusion, Diversity, and Equity. Patty Habeberger, Associate Vice Chancellor for Human Resources and Chief Human Resources Officer. Matt Martins, Associate Provost for Academic Programs. Mark McIntosh, Vice Chancellor for Research and Economic Development. Again, John Middleton will be joining us. Jim Stirk, Director of Intercollegiate Athletics. And Gary Ward, Vice Chancellor for Operations and Chief Operating Officer. The very first question comes from a staff member, and this is going to go out to Matt Martins. It says, can a faculty member pivot mid-semester and shift their class online? Matt?
Thanks, Emily. Basically, faculty and other instructors should not be making unilateral decisions to shift the way a course is being delivered mid-semester. I think it's important to remember for our students that if they sign up for an online course, then they'll be expecting online delivery throughout the semester. Same for a face-to-face, same for a blended course. It's certainly possible, as President Choi mentioned in the opening remarks, that as a campus, we may make decisions to have to change the mode of the way we're doing instruction in general for a time. But that on a class by class or a case by case basis, faculty should generally not be making those types of decisions. Now, if a faculty member has some type of health or medical concern during the course of the semester, then they should, of course, talk to their department chair or their HR rep or other appropriate individual, depending on the issue, to discuss what work accommodations might need to be made.
Okay, Matt, thank you so much. This next question goes to John. What will be the threshold for shutting campus down? Is there a certain number of cases that needs to be reached?
So the decision to change what we're doing on campus may not be actually shutting down campus. It may just be changing the things that we do, the educational platforms that we use and so forth. Are going to be based on a variety of metrics. And those metrics are going to include cases in Boone County and on the MU campus. But other things come into play that might not be inherently obvious, and that will be, do we have hospital capacity to deal with a certain number of cases in Columbia, Missouri and on the MU campus? And what is the availability of things like personal protective equipment? So as the situation changes nationally, personal protective equipment could become consumed. We may not have ability to do some of the things that we've planned to do on campus, and therefore we may have to change our plans. So there's a number of metrics that will be considered, and therefore, like I said a few minutes ago, we're going to have to remain somewhat fluid in our plans and also flexible as we move forward, because as I said before, this is an evolutionary process.
Okay, thanks, John. This next question comes from a faculty member, and President Choi will begin with you for questions or answers for this question. It's kind of a long one. Here we go. Some other public SEC schools are implementing far more rigorous safety procedures, including required testing before students are returning to campus, mandatory self-screening using an online app at least every 3 days, sentinel testing of students, faculty, and staff throughout the semester to track community spread, It does not appear that any such measures are in the current Show Me Renewal plan. Why were such measures not included, and is there any consideration being given to adopt such strategies? So President Choi, will begin with you, and then Mr. Middleton, if you have anything else to add after President Choi.
Thank you, Emily. That's a great question. We have been following many universities within the SEC and the AAU, and to determine if our current practice is up to the standards that we expect relative to our peers. And with regards to the testing strategy, at the beginning of the process, we did consider having mandatory testing. We also learned from the CDC that mandatory testing is not recommended, because all that does is provide you, a snapshot of the situation. What is more important is to constantly evaluate the symptoms. And we will be working with Roche Pharmaceuticals to implement their symptom checking app that'll be required for faculty, students, and staff to implement into the app every day, so that we can better learn how the symptoms are tracking, through which we can determine if and when the outbreaks will occur. So we'll have that big data to be able to accomplish those goals. And so, as we stated from the beginning, this is really a living document, a living plan. So as new information is provided by, let's say, the CDC or Boone County, we will always implement our plans to be able to accommodate. I would also like to say that many universities that made the claim that they will do testing for all of their faculty, students, and staff, and claims that were made several months ago, have now decided that that's not the right approach, and they're following the approach that we have currently. John?
Yeah, so as Dr. Choi said, point-in-time testing, in other words, you test everybody at entry to campus, we'll probably find that there are positive individuals, but we'll also find people that are negative that may have been exposed 2 days ago. Their test is currently negative today, and therefore that really doesn't inform how we do infection control on our campus. And so by using symptomology as the initial test, that helps inform, better inform who we should test, and we get a better outcome of that, because we then know the people that we should quarantine and isolate. And then what we do is follow up those individuals that are test positive through contact tracing, so that we can minimize the spread of disease on campus. And that gives us a much more efficient strategy for following the disease on our campus.
Okay, thanks, John. This next question goes to both Patty and Mark, and Patty, will have you respond first. Where can we submit concerns or feedback if we see that policies are not being followed? Patty?
Thank you, Emily. Concerns about student behavior can be reported utilizing an online form that is linked on the Show Me Renewal plan for students under the Accountability Measures heading on page 19 of the plan, and also in the student FAQs. Regarding concerns about employees, we are currently working to develop a similar form that will be placed on the employee page. We are hoping to have this form ready very soon, but until then, you should report concerns either to your supervisor or a campus HR professional. Mark, I'll pass it off to you now.
Mark, you are still muted, so we're going to have you unmute and start from the beginning of your answer.
I apologize. Thank you, Patty, again. So in a research setting, laboratory safety has always been one of our top priorities, and obviously there's a heightened awareness at this particular point in time. Our Show Me Renewal Research Committee has developed guidelines for laboratory safety and new compliance tools to address the unique challenges posed by coronavirus in the research environment. They work very closely with environmental health and safety to create a one-page interface that allows all of our research lab personnel to report their concerns related to laboratory safety and personnel health. This tool reports behavioral concerns such as social distancing and the availability of appropriate personal protective equipment, as well as proper laboratory safety practices and safety features. While it's not required, researchers and lab members may provide their name and contact information while reporting these concerns. It is important to note that this tool, called Health and Safety Concerns, is available on both the Show Me Renewal and the Research Restart websites, which empowers our research community to keep safety as our #1 priority.
Mark and Patty, thank you very much. This next question comes from a community member, and this is for Jim Stirk. Jim, what are the plans for athletics? Will there be games that fans can attend? And what is athletics doing to ensure safety of athletes?
Well, I'll start with the latter question first. Creating safety is the #1 priority, and we've been working with all the experts on campus and obviously with the CDC. The SEC has a medical task force as well before we even talked about bringing student athletes back to campus. And so we're trying to create the safest environment possible and moving towards with voluntary activities and then moving towards competitions. And so we're still have a target of the first part of September, and we haven't varied from that. If we need to pivot and adjust due to things out of our control as far as the epidemic, then we'll do that. But as of right now, we're planning on playing in September.
Okay, thanks, Jim. This next question is for President Choi, and this one comes from a faculty member. The COVID-19 cases were lower in March when classes were moved online. How do you rationalize opening campus at the height of a pandemic when a vaccine is still not available? President Choi?
That is an excellent question. And those are the questions that our testing, contact tracing, quarantining task force members have been addressing for the past few months. But we believe that there will always be risks in opening up a campus, whether there's a pandemic or not. But our preparation for the education and training of our students to better understand the health requirements that we have through the CDC, as well as that same training for our faculty and staff, and using the proper social distancing, symptom checking, as well as face covering, will protect our community. And this community has followed the rules very well during the past 4 or 5 months of the pandemic. There were only 2 deaths in Boone County, and the level of community spread is lower than what it was in Kansas City, St. Louis, or Chicago. So our goal is to continue with the education training, monitor very carefully the rate of disease spread on our campus and in Columbia, but also at the same time, be prepared for more hospitalization required for COVID patients. And so we will pivot when necessary to be able to go into remote operations again. Because like I shared with you before, the health and well-being is very important for all of us, for our stakeholders.
Okay, President Choi, thank you so much. This next question comes from another faculty member, and it's from Matt Martins. Data show that face masks are the best effective way to prevent COVID transmission. Can faculty use masks with clear plastic over the mouth that are currently being used for the hearing impaired if we feel it is a better option than the face shield? Matt.
So I think the best course of action for that particular situation would be for the faculty member to first have a conversation with their department chair, and then at that point can discuss with the dean and the other representatives who sit on the academic operations team to figure out if that's a viable alternative. As President Choi mentioned at the beginning of the discussion, the critical piece for us when thinking about this was, can we make sure that we have a situation where the instructor can have the face covering and but also be able to deliver the content in a way that the students would be able to, fully experience what's being covered. So that might be a viable alternative. So in that particular situation, bring the request to their department chair, and then we will figure out if it's something that we can implement.
Okay, thanks, Matt. This next question is for John. It reads, and it doesn't say who it's from, but it's for you, John. Will I be alerted if one of my students tests positive?
So a positive test result is a piece of medical information, and therefore it's medically protected information. A student can self-identify that they have tested positive to a dean, department chair, or faculty member, and therefore they would be aware of the fact that a person has tested positive. Because somebody tests positive in a classroom situation does not necessarily mean that that has downstream implications for the rest of the class, because of the infection control procedures that we have in place, the distancing, the face covering, and so forth. So it's possible that a person could test positive and we would not get to know on campus because it is medically protected information, and therefore it does have to be self-reported by the individual.
Okay, thanks, John. Our next question is for Beth Chancellor, and this one is from a staff member. If I continue to work remotely, is there assistance to help pay for a suitable internet connection?
Yes, so right now we are working with HR and within IT to develop policies for that. There's a lot of questions about remote work, not just for IT people, but for all employees, related to what type of equipment they would need at home, whether it's computers, internet connection. And so we don't have the results of that policy. There's still discussion going on about that as to whether or not internet connection costs would be provided. But those policies are in progress right now.
Okay, thanks, Beth. The next question comes from a community member, and it's for Maurice Gibson. How will we continue to support our underrepresented minority community members during this time? Maurice?
Thank you, Emily. And that's an excellent question. And quite honestly, as we are developing all of our processes and procedures, we think of all of our stakeholders, and the community obviously is one of our most important stakeholders as well. So, we want to make sure that they still have access to the university. Obviously, as a state school, we make ourselves available to the university, but we want to make sure it's done in a safe way. So, I know people are probably accustomed to being able to come into the library and use the union as they want, but we want to make sure that we're maintaining the social distancing and our mask policies, not only for our campus community, but also our community partners. We have done, particularly in this division, done a slate of programming that we'll have available for the fall. That still will have some of that interaction. It won't be face to face, but we've done a lot of virtual programming that we can make sure that we maintain that connection to our community partners. So again, we definitely have not left them out. And we intend to continuously engage them through this COVID and afterwards.
Okay, Maurice, thank you so much. This next question is for Provost Ramchan. It's from a faculty member. Will in-person classes end at Thanksgiving break and all finals be online?
At this point, the plan is not to end classes at Thanksgiving. If the situation changes, then we will make appropriate changes. But as of right now, the fall semester is unchanged.
Okay, thank you, Provost. This next question comes from a faculty member. How will the requirements for social distancing and PPE be enforced in the context of student activities like parties, concerts, or sports? President Choi.
Well, it's going to come through education. We can't be everywhere to enforce our rules, and we'll do the best we can, obviously enforcing the rules while students, faculty, and staff are on campus. But it's really instilling in our students that the health and welfare of each one of us depends on how seriously individuals take their responsibility. And there are many students, faculty, and staff who want to come back to that rich campus in-person experience, but that experience will be diminished if we have to have a reversion back into remote operation because members of our community did not take the safety and health precautions seriously. So it is constant reminders and constant enforcement while they're on campus, and also using the buddy system to make sure that we have people who understand that how their actions can affect all of us in our community.
Okay, President Choi, thank you. This next question is for Provost Ramchan. Provost, if I'm notified through the contact tracing process that I might have been exposed, do I need to shut the class down for the duration of quarantine? Am I empowered to move the class online temporarily if I'm feeling well enough to teach during that time? And should I make arrangements for a sub? Provost?
Great question. If a contact tracer notifies a faculty member that they had close and sustained contact with someone who tested positive, then you will be asked to quarantine, and you should do so. The recommendation is that you inform your department chair immediately and work with them to have a buddy or someone else take over the class. And at that point, working with the department chair, you can decide how the class moves forward while you are indisposed. If a student in your class informs you that they did test positive, you don't really have to do anything. Now, of course, recognizing that the student does not have to do that, as John Middleton explained, this is private information. But even if you do find out, there is no need for you to transition to an online modality unless other things change at the same time. I also want to point out that what we're talking about here is close and sustained contact, which is at this point defined as contact with someone who tested positive within a 6-foot distance and for 15 minutes or longer.
Without a mask, without a face covering. That's right. Mm-hmm.
Okay, moving to the next question. This one comes from a student, and this is for Matt. Matt, have you considered the possibility of allowing students to choose whether or not they want to do their courses online or in person?
So with the way that the course schedule is shaping out, as President Choi mentioned at the beginning, we are having to reconfigure a number of our courses in order that in-seat classes can meet physical distancing guidelines and other safety precautions. So compared to prior semesters, there's going to be a more diverse array of modalities. We're certainly still continuing to offer a high percentage of face-to-face courses, but considerably more blended courses where some of the classes online, some of the classes in person, and more online courses than in previous semesters. So I would encourage students to work with their advisors, wait for a couple of weeks until we can get all of the updates to the schedule finished. But if they want to take more online classes and to take more blended classes, to look for options to do so. What we cannot guarantee, because it's just simply not feasible, is that a student could take any class in any format. That's just not logistically possible. But we're confident that in most cases, students will be able to fill their schedule with courses that they want or courses that they need in different modalities if they want to be, particularly if they want to be in more blended or online courses.
Okay, thanks, Matt. This next question comes from a faculty member, and it is for Gary Ward. Gary, what are the current guidelines for hosting events for the upcoming semester?
So there's a committee that is looking into that. They're meeting every week trying to determine, are we going to have outside groups be able to come on or just inside groups, and how that's going to look. Obviously, we're going to have to keep social distancing and mask wearing and those type of parameters in place. We hope to know more about that within the next week or two to be able to publish that as part of our Show Me Renewal plan.
Okay, Gary, thank you very much. This next question is for Patty. Patty, can staff shift back to working from home at any point if they don't feel safe or if cases rise?
Thank you, Emily. As we move forward with repopulating campus, college, school, and division leaders are responsible for implementing work plans for their areas. This can include working on site, remote work, or hybrid work options that might stagger the hours or days that employees are scheduled. Employees with their own underlying health conditions have the option to notify their supervisor and our Human Resources Office, and primarily their assigned HR professional, of their concerns and request a reasonable accommodation. Employees should work with their supervisor and or unit leadership to receive approval for their specific work arrangement requests. Supervisors and unit leaders should consider a number of factors, such as the employee's particular job duties, their ability to work remotely, meeting the business needs of the unit, the overall work environment, etc. However, if feasible, supervisors are encouraged to provide telework options to employees or groups of employees whose job duties can be performed remotely without disrupting university operations. As some of my fellow panelists have already mentioned, the university will continue to implement public health practices, such as social distancing, face covering requirements, and more, and will adjust health and safety guidelines to provide the safest working and learning environment possible for faculty, staff, students, and others in our community.
Okay, thanks, Patty. This next question comes from a faculty member, and it's for Provost Ramchan. Provost, it sounds like a positive COVID student in my class might not become information to me. As a high-risk individual, this is alarming. I initially chose face-to-face for my class, but now I am rethinking that decision as I do not want to live and teach in fear every day. Is it possible to change my class election at this point? Provost?
Thank you, Emily, and thanks to the faculty member for that question. We sent out guidance on those issues about a week or so ago, and my suggestion would be that the faculty member contact their chair, who will then work with HR to the extent possible to decide how best to address that situation.
Okay, Provost, thank you very much. This next question, also from a faculty member, is for Beth Chancellor. Beth, how is IT preparing for the influx of support that will undoubtedly be needed for faculty members who might have to make quick changes after hours? Beth?
Thank you, Emily. Yeah, so we have a team of IT staff that are distributed all across the campus. Many of our IT people are working remotely, but in some cases, IT staff can't work remotely because there's a physical nature to a lot of the work that they do. We have regular schedules of cleaning of IT equipment that is shared, including recently some discussions about making sure microphones are cleaned. We are spacing computers farther apart if they're multi-use computers. We're placing hand wipes as long as supplies are available in classrooms and auditoriums so that faculty who go into those spaces and aren't 100% sure that the equipment that they're using is clean, they can clean them themselves if they want to take extra precautions. And then, of course, to protect our own IT people, we're giving them protective equipment and putting in shields for our ID office and other places where we do have to meet with people face to face. For faculty who need to make last minute changes, I would ask that they contact their IT support team. All of the teams are gearing up and have been gearing up to provide equipment and software that allows them to work remotely if they need to. And then, of course, our e-learning team is prepared to help faculty get their courses online if they need to get their courses online in a pinch.
Okay, thanks, Beth. John, this next question is for you. What information will be provided about campus data, positivity rates, number of tests?
So we're currently working with the health department as well as MU Student Health to construct a dashboard that will give information such as the number of positive cases of those tested through student health. Bearing in mind, as I said before, that this information at the individual level is protected, but what we're hoping is to give some high level data so that folks have a estimate of what's going on campus, very much like you would see if you go to the como.gov website and look at their dashboard. Bear in mind, though, that because we're using student healthcare data, that not all of our students may seek testing or healthcare through the student health facilities, and therefore we may not have complete data, but it will at least give you a snapshot of what's going on campus.
Okay, thanks, John. This next question is for both President Choi and Provost Ramchan. It comes from a staff member. In response to the economic crisis created by COVID-19, the Program Audit and Review Committee that you established has been making recommendations for program closure or consolidation to you and Provost Ramchan. When are their processes and recommendations going to be made public?
So let me ask the Provost to begin, and I'll have some comments. So Provost?
Thank you, President Choi. So the process for moving the recommendations from this committee is as follows. The committee shares their recommendations with the president and myself. We then invite faculty, the department chair, and the dean of the unit that might be impacted by that recommendation to present any data, provide us with any input that might suggest otherwise, that might give us other indications about the recommendation. We review all that information and then make a decision which is publicly shared. We do not intend to share the recommendations unless they are converted into actionable decisions. And we have been following that process to this point. At this point, I just want people to know that the process is in place and we are working on that, but we don't have anything to share as of yet.
Nothing more to add other than the primary focus of PARC is to identify, is to really create and sustain programs of excellence at the university. And there may be some programs or units that made sense 20, 30 years ago, but we're asking the question, are they still relevant? And do they provide the return on investment that we expect at an AAU university?
Okay, President Choi, Provost Ramchan, thank you very much. This next question is for Matt, and it is from a staff member. It has been discussed that there are measures being taken to ensure social distancing being observed in classes. Is there a percentage of capacity that is being used to help with enrollment in classes? And is there any idea of how many students will be returning in the fall? Matt?
So we're actually doing more. I know a number of our peer institutions have been using percentages. We've actually, much to my chagrin sometimes, and especially operations chagrin, gone a few steps further and have actually figured out classroom capacity to where the 6-foot social distancing could be maintained, with the exception of lab classes where we have some different parameters in place, including extra precautions in terms of face coverings. So the gist of it is that thinking about our traditional classrooms, and this goes back to the question that Provost Ramchan had sent to her, our students should all be at least 6 foot apart from each other and from the instructor, which, along with the face coverings, means that the best available evidence suggests that this is a low risk disease transmission environment. So we're really doing all that we can, and we really have to give a major kudos to operations here for all the work that they're doing, is to ensure not just making kind of an estimate based on fire code capacity or something like that, but actually trying to figure out, what is the most number of students we can put in a classroom and maintain the distance, and that's our capacity. And we're not going one student above that. So I'm really proud of the work that different groups have done to ensure that whatever the cap is in the particular classroom, it's meeting our current public health guidelines in terms of physical distancing.
Okay, thanks, Matt. This next question is for Gary, and it comes from a faculty member. Gary, are there any dates established for when campus is reopening to faculty and staff? When can we expect to freely return to our offices? And when will staff be asked to come back to campus if possible? Gary.
So each unit is to be working on their return plan through their department chairs, their deans, or through their vice chancellors and their heads. And then that plan is the one that we are looking at for implementing. Those plans are sent to me and others, and I'm making sure that, or we're making sure that those spaces are properly prepared for those returns. So those plans, if they haven't been communicated, will be soon for every single individual.
Okay, thanks, Gary. This next question, we'll start with Marcia, and then Patty, if you have anything to add, feel free to chime in. This comes from a staff member, and it says, what is the protocol should a staff member be exposed to another person that is tested positive for COVID? Will the office with the exposed staff member need to shut down for a designated period of time? Marcia.
So again, maybe a little more details to know precisely what we're saying. If they're saying that they've been contacted by the contact tracers that they need to quarantine, then similar to the answers that have previously been given related to faculty, then they would be asked to do that. Additional cleaning measures would be taken to ensure that the space is then available for that. I don't know if Gary wants to add anything from the facility standpoint as well.
Thank you. Yes, we do make sure we go in, we disinfect every single space that has any kind of contact tracing that leads back to us. And we will continue to clean those spaces. We just don't do them one time. We continually go back to all of our spaces on campus.
So Gary, when that staff member is potentially exposed and you shut it down to clean, I'm assuming no staff members in that office will be allowed in during cleaning?
Depends on the shape of the suite. If it's a small suite, no. But if it's a larger suite that we can take a part of it off, we can just get in there and disinfect that or fog it or whatever we need to do to get in.
Okay, thanks, Gary and Marcia. Patty, was there anything you wanted to add?
No, I don't think so. I think it really does depend on like if they were a close contact even or not. And I mean, it's just kind of hard to tell without knowing a little bit more details, but I think I agree with what everyone else has said.
Okay, thank you. Our next question will be for President Choi, and this was from a community member. What can alumni do to help in your efforts? President Choi.
Oh, yeah, they can do a lot and provide us with moral support. And whenever they see a student that you believe is attending Mizzou, remind them to wash their hands, wear their face mask, but also participate in some of our events with us. We're going to be having many Zoom webinars that really illustrate the best of what we do. And share the message, the positive message that this university serves the entire state of Missouri, and how proud they are of our strong efforts to prepare for a safe reopening in the fall.
Okay, President Choi, thank you so much. Mark, this next question is for you. Can those who manage labs have their own stricter class policies if they are worried about safety? For example, can a lab manager say N95 masks are required for this lab, not just a face covering?
Thank you for that question. No, in general, laboratory practice and laboratory coursework, we expect faculty, staff, and students to follow the campus guidelines, as Matt noted, in the academic spaces, also in the research spaces, proper social distancing, physical distancing, and face coverings will minimize the risk of transmitting the virus. And so those guidelines are put in place with that precaution in mind. Now, obviously, there are some very special circumstances in laboratories where elevated containment is required, but that is really based upon the research being done in there and not safety precautions related to general laboratory in classroom work.
Okay, Mark, thank you very much. This next question is for Beth Chancellor, and it comes from a staff member. Beth, what is the status of the transition to Microsoft Teams, and is IT ready to help those working remotely to make that transition? Beth.
Thank you, Emily. Yes, Microsoft 365 is available now. There are instructions on how to get your account set up on the Do It website at doit.missouri.edu, or you can call the help desk and they can talk you through it. Microsoft Teams is part of that suite of tools that are available. And if you have trouble using Microsoft Teams, you can call the help desk and we can get you additional help. It's fairly intuitive. I think that, you know, everybody on this panel has been using Teams on an occasional basis. And then if you need extra help with Teams or with any of the Microsoft tools, reach out to the IT pro that supports your department and we will find resources to get you additional training. You might want to keep in mind that there is a lot of training available on the internet. You can go to Microsoft's website. There are videos on how to use the tools and instructions. Again, most of them are intuitive, but if you need extra help, either contact your IT professional or go online and Google it, and you can learn a lot that way too.
Okay, Beth, thank you. This next question can go to either Patty or Marcia. You both can answer if you'd like. It comes from a staff member. Is the university making any further plans to support families in the event K-12 school is called off for an extended period? Many departments would struggle with a large void that working parents would leave to homeschool and caring for their family. I'm most concerned about single parent families, those who have no extended family support nearby, and families with many young children who will need supervision at home. This describes a large portion of university staff. So Patty or Marcia?
Patty, I might start and then you can fill in what I miss. I think what I'm hearing most out of that question is the key for communication, the communication between the employee and the supervisor to see what arrangements can be made. Of course, all of us at the university want to meet our responsibilities to the students and to our constituents and fulfill our job duties. So I think key is communication with the supervisor to see if working from home arrangements and things like that are available or not. There still remain in place some policies, HR 700, that folks can look at that do allow some paid time off as well as some unpaid time off if a school is closed. And that may depend on whether they've used some of that leave prior in the prior semester. So I would encourage them to talk to their supervisor, talk to the HR professional, and have a good line of communication.
Yeah, I totally agree. I think that we will be encouraging our supervisors to exercise some flexibility and adaptability, and depending on what their situation is. And as Marcia said, we may have some policies that might be able to help them.
Okay, thanks, Patty. Our last question will go to Gary Ward. Gary, what is the status of our HVAC systems on campus? How will adequate, safe ventilation in all buildings be assured even during the winter? Gary?
Thank you, Emily. And this is a question I'm asked quite a lot. So there's a national organization called the American Society of Heating, Refrigeration, and Air Conditioning Engineers, or ASHRAE for short. This is our nation's indoor air quality experts. They have been all over this COVID since February, and they've been putting out recommendations to the building owners and managers groups since then. And I can tell you that we meet or exceed all ASHRAE recommendations. But as you've heard throughout this presentation today, that things change. And as they change, we will continue to watch and listen for the recommendations and make whatever changes are required. But right now, we meet or exceed all the recommendations for our building's HVAC systems.
Okay, Gary, thank you very much. So that concludes our first town hall today. Thank you so much to everyone watching and streaming this right now. If you missed anything, it will be available at chancellor.missouri.edu under the Town Halls tab, where you can watch the full recording once it's uploaded there. Of course, we received hundreds of questions today. A lot of them were very similar, and we touched on a lot of them today. Some of them were more individualized, so we'll be working on getting those in more individual specific questions to the departments that will do a clear job at answering those questions for you. For now, I'm going to turn it over to President Choi to close. President Choi.
Emily, thank you for that outstanding job as a moderator. And let me close by saying how proud I am of the faculty and staff who really stepped up to prepare the university for the reopening. We had faculty members, staff, and students in engineering developing and printing 3,000 face shields for our instructors. We had faculty members and staff in biochemistry developing new technologies to test sewage to be able to determine the presence of COVID-19. And our faculty members and staff in health profession and the School of Nursing are training our contact tracers. And on top of that, our outstanding faculty in the School of Medicine developed the first clinical trial for a very rapid optoelectronic technique for determining COVID-19 at the point of care. These types of innovations will help us and our community and the rest of the country become safer. And I'm so proud of their work and the work of more than 150 professionals at the university that developed the Show Me Renewal Plan. And we can't wait to have you back. And we look forward to seeing you in a few weeks. So thank you. I think we're done. So thank